Rebecca Moorhead, and I'm here just to introduce our presenter tonight. We're so privileged to have Dwight Franklin, acupuncture physician. He's dedicated and experienced, and he believes in working closely with the patient to make sure to improve and maintain their health. He specializes in working with children suffering from ADD, ADHD symptoms, and autism. Dwight has a master's degree in Oriental medicine and a bachelor's in health studies. He started his career as a massage therapist over a decade ago, where he worked in many clinical environments. And while working with a well-respected psychiatrist at the Katie Wellness Institute, he collaborated with other physicians on many patients with various mental and emotional disorders. He's going to be talking tonight on very many disorders that he's working with. So without further ado, let me introduce Dwight Franklin, acupuncture physician. Dwight, are you there?
I am here. How is everybody? Hope everybody's okay. All right. Thank you so much, Rebecca, for that introduction. You basically said my whole bio. I appreciate that. I'll just give some, quick little tidbits here about how I got started. I got started in 2003, actually, as a massage therapist. I specialized in a therapy called craniosacral therapy. Now, I could talk for hours about that alone, but I will leave it to this. Craniosacral therapy is a very light touch therapy to the bones of the skull and the bones of the vertebrae, and it has great effect of all the underlying tissues, including the brain and spinal cord, and helps them both function optimally. It's wonderful to use with children with ADHD, autism, people with anxiety in general, just any kind of stress, digestive disorders, and so on and so on and so on, because if your brains function properly, then everything typically functions better. Okay? Yeah, I got my start over at the Katie Wellness Institute in Evansville, Indiana. The psychiatrist there, his name was Dr. Lewis Cady, and he practiced what we call functional medicine. Now, he did prescribe medications, with some cases, but functional medicine basically just means this. When the body's getting exactly what it needs, then problems aren't there. At least not problems that we are seeing lately, with all the heart disease, all the cancers, and with these kids, just outrageous numbers of ADHD and autism and anxiety issues and just digestive issues and just so many different things, allergies also. So with functional medicine, you're just trying to give the body what it needs, and that means that you're eating right and you're taking the right supplements. Okay, and also changing lifestyles in terms of physical exercise, maintaining stress levels to where they're not so out of control that your body starts to break down because of it. So I worked with Dr. Cady on a lot of different cases, but I wanted to further at my education, and that led me here to Orlando. And I went to Florida College of Integrative Medicine here in Orlando, and that is where I learned Oriental medicine. Oriental medicine, many people just think of, an acupuncture physician just as acupuncture, but we also learn a tremendous amount about herbal medicine, which is basically just the use of plants, minerals, spices to help the body function better and to we use herbal medicine for things such as digestion issues. We have herbs for that. We have herbs to help the mind calm itself down for people who are having intense stress. We have so many different herbal medicines for gynecological issues and just anything you can think of. We have it because we've been around for thousands of years. Modern medicine's only been around for a couple hundred years. We've had a lot of time to kind of get everything straight and to really do it well without all of the side effects that a lot of modern medicines have. Okay, sometimes there's reasons to do modern medicine in terms of actual pharmaceuticals, but typically speaking, once again, once you give the body what it needs in terms of diet, exercise, stress reduction, you typically don't have all of the issues that a lot of people have today. Like Rebecca said, I have a master's degree in traditional oriental medicine and a bachelor's in health studies. I also work a lot with food therapy, and with the kids can be a little skittish of needles, so I typically do acupressure with them instead of just the acupuncture. I usually can, after seeing them for a month or so, I can usually get them to try one needle, and then we'll do 2 or 3, and I mean, I just put 12 needles in a little autistic boy, 5 years old, and he just didn't flinch at all, so they tend to, after some time, they tend to get very used to me and start to trust me, and we can bring in the acupuncture as needed. I am currently the owner of Franklin Family Acupuncture, and I work out of a larger office called the Cannizzaro Integrated Pediatric Center. And that's the head medical doctor here, and he's been a medical doctor and a pediatrician for the last 35, 40 years. Dr. Joseph Cannizzaro, and he's kind of one of my heroes. He has been practicing functional medicine for the last probably 20, 25 years. He, just like a lot of medical doctors, they weren't happy with the results that they were getting practicing just giving these kids medications. And yeah, he found such help with lifestyle, food changes, supplementation, and yeah, he's really well known in this area and very well thought of. But yeah, we collaborate together, me, Dr. C, and we have another medical doctor, Dr. Craven, and then we also have a neurofeedback guy here who is just absolutely amazing. So yeah, it's a little bit about me. I'll answer any other questions you guys have at the end about myself, so let's move on. All right, this is the Nutrimetrics DNA Miracles line. Now, in that line, we have a pycnogenol product, which is your OPC3, and I will explain in great detail about these products as we go along, but I'm just going to give a quick little shout out to each product right now. We have 2 probiotic products for the kids. We have an omega-3, we have digestive enzymes, and we have a couple different versions of a multivitamin. Before I get into each individual product, I want to just tell you a little bit about how I'm going to do things tonight. I want you guys to have a pretty good understanding of the why that we give these supplements. It's kind of like when you come to Market America and they ask you your why. Why are you doing this? Why are you doing this business? Well, if you don't know that why, you're not going to get very far. Same thing with this. It's nice to know that OPC3 is great for ADHD and autism and so many different digestive issues and inflammation and pain and all those things. That's great to know that, and people who have kids with those issues will definitely probably listen to you. But if you know why you're giving it and what it actually does in the body, I don't expect you to be a medical doctor or anything like that, but if you have a basic understanding of what it's actually doing in the body, people will listen more attentively. Okay. Yeah, you see a lot of things on Facebook. You hear this from different people that that here's the greatest new product out there, it'll change your life, blah 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 blah, and that may be very well true, but a lot of people tune out when they hear those things because they think it's just another one of those things. So the more you guys know about why we're doing this, then you will get very far with the people you're trying to introduce to these products. Okay, so moving on. All right, health problems children are facing and why. ADHD, as of 2011, 11% of children are diagnosed with ADHD, of all children. Okay, now that's a pretty scary statistic. Over 1 in every 10 kids are going to be diagnosed with ADHD. But what I've found about statistics, they can be helpful to, kind of making people say, wow, that's interesting, but, numbers can be cold, and they don't quite tell the whole story. With these kids, when I have a child walk into my office, I don't just, hear, oh, they have ADHD or treat them. I get to hear their whole life story. And what that 1 in every 10 children actually means is 1 in every 10 children are being told, probably by somebody at some point in time, somebody in their community, that they're not good enough, that they're bad kids. Every parent that I've come across that was a very caring parent, and 99.9% of parents are, will have a horror story about somebody in that kid's daycare that just was very just disrespectful and hurtful. And, I've had kids be called evil and just so many harsh things. And when you start to understand what these kids are going through in terms of their poor digestive health, that actually triggers, I'd say, most of their issues. It's so hurtful that people would say those things without completely understanding what's going on. 1 in 10 of these children, their parents are going to come to me, and they're going to cry their eyes out for these same reasons. And they're also going to cry because they probably have spent tons of money trying, once again, the latest, greatest thing, and maybe it didn't work, or maybe they needed to do it longer, but they didn't have the income to do so. They don't know where to turn next. And 1 in 10 of these children, their parents are going to have so many marital issues that come up because of such stress in their life over, what's going on with their child. So these parents are more apt to, get divorced and just have problems in the marriage in general. And, it's you get to see and work with everything when you work with these kids. You're not just treating the kids, you end up treating the whole family because it's such a burden on them. The kid's not the burden, it's just the situation's a burden. So moving on, autism. As of 2010, 1 in 68 children are diagnosed with autism. Now, I can promise you, after 5 years, being 2015 now, that's definitely risen. Autism is, Dr. C always says that there's 4 A's, the 4A epidemic he calls it. That's ADHD, autism, allergies, and asthma. And he would know, he's been practicing for 40 years. He has seen all 4 of these just skyrocket. And he believes very strongly, and I do too, that one of the main reasons this is poor digestion. And I'll explain that here in just a moment. But each one of these syndromes, these disorders, are just a step above, the one before it. Allergies are really tough. Asthma is even worse at times. ADHD is extremely tough, but it's still, it's not a competition here, but autism is by far one of the, hardest things it's not hard to work with, but it's hard seeing the parents go through everything that they've gone through so far, and watching the kid, they've gone through a tremendous amount themselves. So with that said, allergies, once again, both food allergies and skin allergies have steadily increased from 1997 to 2011. Kids are allergic to everything. I've had kids allergic to, I've said this when I spoke a few weeks ago, I've had kids allergic to asparagus, things that I, as a Chinese medicine practitioner, things that should help, they're allergic to. And that makes things kind of difficult, okay? I've had kids allergic to cucumbers and, things that would, actually help their digestion in a normal functioning body. It's actually causing aggravation. So why is this? Well, here's the whys. or the causes actually. Um, Dysbiosis. Now, all that term means is basically there's a microbial imbalance on or in the body. Okay, these kids are um, have been on antibiotics typically. The thing they don't tell you about antibiotics, and some of you, probably already know this, but it kills everything. Okay, it doesn't just kill the bad bacteria that's causing the problem. It kills the good bacteria as well, and that good bacteria helps your body to fight off infection. It helps your body to digest foods and get the nutrients from them. It helps, stimulate certain vitamins and minerals, and so these good bacteria are so important in the body. But when we do antibiotics, it just kills everything, and then you're left with a body that does not know what to do. Okay. There's, I want to say that there is obviously reasons why we do antibiotics, and I don't want to take away from that. It's just the overusage of them, and so many doctors are prescribing antibiotics without knowing how helpful, and not just helpful, you have to do a probiotic if you've been on an antibiotic, period. Okay? You have to. But a lot of these kids are walking out of the office with the antibiotic and not a single word spoken about probiotics. All right? So that's dysbiosis. A couple other reasons for dysbiosis is cesarean births. Babies that are born C-section. Well, one of the first opportunities for these babies to pick up the good bacteria is by being born vaginally. And so many babies are not, these days. They pick up the good bacteria from their mother, coming through the birth canal. So they lose that typically. And then we have lack of breastfeeding, and that's not necessarily, I don't want to play a blame game here, because there are various reasons why mothers don't breastfeed. A lot of times, and I work with these kids as well, I work with these babies and the mothers on how to help them breastfeed. It can be very painful. The baby can not be latching on properly, and it can be very difficult for the mother. And if we don't work with those people those mothers in time, they may kind of just give up because it's been so strenuous on them. But they're lacking, the good bacteria that they get from, the breast milk. Okay. And 4 is diet. Now, I really read a good article on this the other night. I can't remember exactly the whole story, but basically a health professor at a college did a little experiment of his own with his son, and he fed him, the son was in college as well, so the kid was only allowed to eat McDonald's for 10 days straight. And then the health professor, I believe he was a doctor of some sorts, he did some labs, and within 10 days, 40% of the good bacteria strains in his fecal matter were gone. Okay, so that's 10 days of eating McDonald's, and you've just almost halfway destroyed your whole being. You get so much benefit from that good bacteria. It helps with your immune function. It helps with your digestion. So many things, and it's gone with the way that you eat. All right. Okay, moving on. Inflammation. Inflammation comes in various forms, and this I'm talking about systemic inflammation, but most importantly, inflammation along the walls of the small intestine, where you absorb most of your food. Okay. Poor food quality, as we just spoke of, additives in our food dyes, preservatives. And then, simply the inability to break down foods because you're lacking that good bacteria that I just spoke of will leave this food stagnant in your gut, and it will rot, it will become rancid, and that will cause inflammation along the lining of the small intestine. Okay? and going even further as well. So, I want to speak a little bit about what that inflammation actually does and how it relates to everything that we're going to talk about tonight. In a healthy person, the small intestine absorbs very well broken down particles of your food, nutrients, minerals. It absorbs it through the walls of the small intestine, and it enters the bloodstream to be used by the body in, the manner it needs to be. However, when you have all these different things going on, you get these larger particles of food, and they're in the small intestine kind of sitting there. And with the inflammation that's going on, that wall of the small intestine becomes compromised. So what happens is you get larger parts of these foods that aren't broken down properly leaking out of the small intestine into the bloodstream, and the body does not recognize what it is. It doesn't recognize it as a mineral or a vitamin or anything like that. It recognizes it as something harmful to the body. So it attacks it. And this is why you're getting kids that are allergic to asparagus and allergic to cucumbers and, God forbid, peanut butter. Okay? So, yeah, that's the whole, that's why we're seeing such an outbreak in allergies with these kids. Also, this can also, these toxins that are produced by these foods can cross what we call the blood-brain barrier, along with some of these preservatives and additives and dyes, and that causes inflammation in the brain itself. And then, hence, you have ADHD symptoms. I don't want to discuss a whole lot about my viewpoint on autism and why it is. I know that's a big, huge debate, and I try to stay away from those political manners. But I do say that the digestive function is so important when helping these autistic kids. Okay? Yeast. Yeast is simply a fungus that thrives in an unhealthy digestive system, and it's usually because of microbial imbalance or the dysbiosis. There's so many good bacteria that help to keep that yeast at bay. Now, when these kids are given the antibiotics or whatever, well, those good bacteria is gone, and that yeast thrives. And yeast has been attributed to so many different issues, low energy, hyperactivity. It could go on and on and on. One thing that I'm going to tell you guys the supplements that are going to help get rid of these issues, obviously, or at least greatly control them, if not, definitely help them tremendously. But I want you guys to know that some of these tougher issues, it's not like you give a supplement and every single time the problem is just gone. When the kid has a yeast issue, you want to start them on a probiotic. However, that yeast does not die without a fight, and it doesn't go quietly. When the yeast dies, it produces a little bit of toxin, and then that can exacerbate the symptoms short term. Okay? So you may have people that you give these products to, and they say, he's worse now than ever. Give it time. I have seen kids that have been put on a product, and maybe they have a bad, what we would call a bad reaction, or what society would call a bad reaction the first week or two. But in a month, 2 months, 3 months, the kid can be a different kid. Not even a different kid, just the best version of themselves. So just please, if you do one thing for me, just make these parents know that when you're telling these parents, hey, I've got a great product for you, let them know to give it time. Okay? Moving on. All right. The DNA Miracles probiotics. Number one, we have the DNA Miracles Probiotics Extra, and that's actually for kids 0 to 2 years of age. It has what we call 200 million colony-forming units of healthy bacteria, good bacteria. We have the L. reuteri, excuse me. L. reuteri is a bacteria that's commonly found in breast milk. Okay, it's great for overall digestive health. It's been shown in studies to be effective for improving colic symptoms and actually helping relieve rotavirus-induced diarrhea. Okay, and then we have L. rhamnosus, which is shown to reduce intestinal permeability. Remember what I just said. All this food leaking out of the small intestine. You guys probably know it by the term leaky gut syndrome. Okay, I heard from our medical doctor here, Dr. Craven, that that's not really a clinical term. You would call in a clinical setting, you would call it malabsorption. But yeah, L. rhamnosus helps to reduce the intestinal permeability. So it's wonderful for irritable bowel, Crohn's, and to reduce those allergic reactions that those kids are having. In this formula, we have 900 milligrams of prebiotics also, which help the good bacteria to flourish. Okay, and these prebiotics are also found in human breast milk as well. So basically, you're just feeding the good bacteria and helping it thrive. Okay, I said this in the last time I spoke with you guys, but for those of you that are just hearing this for the first time, if we could get these kids who were born cesarean, who weren't breastfed for whatever reason, who maybe have already been on an antibiotic for some reason, if we could get them on this probiotic, who knows what you might be helping them with going further. You can't really say that they would get ADHD or any other disorder, but if that digestive system is working properly, I would say they're much less likely. Okay? All right, so the next one we have, and this is for the kids that are older than 2 years, we have the chewable probiotics, which is 5 billion colony-forming units, and I'm not going to go over every strain, but it's 5 different strains of good bacteria. Promotes healthy bacterial balance in the upper respiratory system, your mouth, your digestive system, and we have a patented technology called LiveBac that helps these microorganisms stay alive through the packaging process and when they get to us, because the bacteria has to be alive when it enters our body. Okay? All right, and kids always like chewables, of course, so they take it really easily. Next. This is just a quick little peer-reviewed medical article that I found. Let me get the synopsis of it here for you guys. Yeah, this is a peer-reviewed article on L. rhamnosus. Out of 56 children with allergies to peanut butter, after being given the L. rhamnosus, for 2 to 5 weeks, they had no symptoms of that allergy anymore. Okay, so basically, what it's saying is these probiotics. That kid in class that will die if he has peanut butter, and nobody is allowed to have peanut butter around him, and all those things. These probiotics can help with that. Now, obviously, I don't suggest you guys going home and doing your own little lab test with your kids with this, but definitely know that these good bacteria can help these kids' immune systems to where they don't have these just insane allergic responses to common foods. Okay? All right, next. This is the Nutrimetrics DNA Miracles OPC3. Let me just take a step back for a second. I want to tell a quick little story, and I think I also shared this with the last time I talked. But I treated a little baby that at less than 1 year old, I believe she was, already had developed hemorrhoids. The kid had been on an antibiotic. The kid was not breastfed because of actually the mother didn't know what she didn't know, and that happens a lot. She went vegan for a good 6-7 months, during the birth or before the birth, and that that was still going on after the birth, and she wasn't getting the nutrients that she needed to promote her breast milk. And so the baby didn't have enough food to eat, and the baby missed out on a lot of good bacteria and was given a formula that maybe wasn't the best for her. And that's when constipation set in, and that's when this poor little baby ended up with a hemorrhoid, at such an early age. But, if we could work with these parents to help them understand this, that, things like that doesn't have to happen, okay? All right, back to OPC3. OPC3 is an extract from the French maritime tree bark, also called pycnogenol. It has powerful antioxidant effects, and it has high anti-inflammatory effects. Now, many of you probably understand how antioxidants work, but for those of you who don't, let me just give a quick little synopsis. Oxidation is a normal process of your body, okay? However, we have something called excessive oxidative stress that is not a normal process of the body. And that is what it's been linked to heart disease and cancer and so many different other issues. Okay. Now, what's actually happening is when a body function happens, you have a little bit of oxidation that happens. And what you're left with, these leftover electrons through that process called free radicals. Now, in a well-functioning body, those free radicals are neutralized by what we call antioxidants. Okay, and those come from various sources, plants, fruits, vegetables, but OPC3 is one of the strongest. Okay, now, in a poor functioning body, those leftover electrons will just start to steal electrons from other cells, and it will continue and continue and continue in a chain reaction, and that's where some of these larger chronic issues can come into play. Okay, so we have powerful antioxidant help with OPC3, and we have anti-inflammatory effects as well, as I said. Anybody that's had long-standing bouts with pain know how helpful taking an anti-inflammatory is. However, when you're taking ibuprofen, you're taking various other anti-inflammatories, you can actually damage the stomach lining. Okay. Because not only are you neutralizing or inhibiting is a better term, inhibiting the enzyme that causes the inflammation, you are also inhibiting the enzyme that makes your stomach lining. Okay? So it causes lots of stomach issues. However, our OPC3 does not do that. We cut out the inflammation and everything else is left functioning as normal. All right. In our OPC3, we have a few other ingredients as well. I already said the pycnogenol. Grapeseed extract, high antioxidants. Grape skin extract, high antioxidants. Bilberry, same thing. Citrus bioflavonoids, same thing. We have also hyaluronic acid, which is a very lubricating substance and helpful for healthy skin, tissue, joints. We have biotin, which is a B vitamin, and that helps with the metabolism of proteins, fats, and carbs. You have D3, which helps with the absorption and retention of calcium in the bones. Vitamin E, strong antioxidant. I think I might be getting some feedback here. I hope you guys can hear me well. Vitamin E, great for cardiovascular health. We have calcium, strong role in bones and teeth health, and helps with contraction of skeletal and heart muscles. And then magnesium is also in the OPC3, and that supports the production of neurotransmitters and also has a very calming effect on the body. We are the only company that makes pycnogenol in an isotonic form. And what that means is, for those of you who don't know, isotonic simply means same pressure. And in this instant, it means the same pressure as all the other fluids of your body. So when you take this OPC3 on an empty stomach, then you absorb it automatically. It goes right, it bypasses the stomach, it goes through the stomach, but it doesn't have to be, broken down in the stomach. And it goes into the small intestine, into the walls of the small intestine, into the bloodstream to be used by the body, okay? Because it doesn't recognize it as food that needs to be broken down. So that's why you take it on an empty stomach typically. Yeah, and we're the only company that does it, so any other pycnogenol products know that it's been shown that this form is more absorbable than all of the others. I had a little boy who I put on the OPC3 a couple months back, 2-3 months back, and it was a real interesting situation where the mom was all worried about school and how he wasn't doing very well in school. And his attention span was just off. He didn't have the hyperactivity, but his attention span was just not there. Dad, however, Dad was a big sports nut and great guy, but just a big sports guy. Played college baseball, had some uncles that played professional, and all he was worried about was the fact that this kid, when he was younger, he said this kid threw a baseball when he was 2, he threw it so well and so coordinated. And now he showed me exactly how the kid throws the baseball now, and it was very, uncoordinated. And he was this dad was very tore up about this, and he wanted to know why this kid had regressed in terms of his muscle coordination. Well, we did a lot of therapy, but I honestly seen the biggest change when we added the OPC3. So let me tell you what's going on with this kid now. This kid that was getting bad grades, not because he wasn't smart enough, but because he couldn't pay attention, he's getting A's and B's now. The kid that rarely touched the ball when he was, swinging, is now hitting home runs. And his mom and dad are just thrilled that they can't. The whole family's taking OPC3 now. All right, and we have it also for the. And now this is hard for me to believe, but we have this in a chewable form for the kids who don't like the taste of the OPC3. I work with Chinese medicine, which means I work with Chinese herbal medicine, okay, and we're talking roots and grasses and seeds. And let me just say this: my formulas, the herbal medicine formulas, they taste a little bit like dirt water. So kids, when they come to my office, they have to get adjusted to taking the Chinese herbs. And it's a process, but they do get it. But I've heard, from other parents that are in, Market American Nutrimetrics. I've heard from Rebecca and Lisa Tolbert that, their grandkids have a little issue taking the OPC3 in powder form, and they have various ways. I think Rebecca says she mixes it with the multivitamin. But yeah, that's hard for me to believe that, they don't like the taste of OPC3 because it really tastes pretty good. I think it's got a kind of a grape flavor. So yeah, the chewables are there if need be. Moving on. This is a quick study on OPC3 and ADHD. And I invite all of you guys to really use these studies to your advantage if you approach a doctor with this supplement line. Show them these studies. Okay, they may not, like I said before, they may not want to hear about the latest greatest thing, but if they care about their patients, they can't really ignore these studies. In this study, 61 children were given either pycnogenol or a placebo for a month, and the results were, drum roll, significant decrease in hyperactivity, better motor skills, improved concentration, improved attention, but there was no change in the placebo group. Imagine that. Moving on. Here we have the DNA Miracles Essential Omega-3. A brain is made up of 60% fat and it needs healthy fats to function well. Now, DHA and EPA are the two main omega-3 fatty acids that are most important to your brain. Now, some people and I have nothing against vegans and vegetarians. They have there's a lot of benefits to being a vegan. But in this case, when working with these kids, go with this fish oil supplement. And here's why. ALA, also an omega-3, and this is found in chia seeds and flax seeds, has to be converted to EPA to be used by the body. Excuse me. Now, this is an inefficient process, even in healthy people. So you end up with not a whole lot of EPA for the amount of chia and flax seeds that you eat. Now, on top of that, we have children with compromised digestive systems. So the kid that is eating, that's not able to break down a carrot or an asparagus stalk, do you think they're going to be able to break down seeds? Not very well. So they're not going to get the ALA from that as well as they need to, and even if they did, it still wouldn't be enough EPA for them. So go with the fish oil. Our formulation has 500 milligrams of, and I don't know if I have this backwards or not. 500 milligrams of EPA and 300 milligrams of DHA. I think that's correct, but I'll have to check on that. And they all come from sardines and anchovies. Smaller fish have less mercury toxicity. So just be aware of that. The fish that are really safe to eat are your sardines, your anchovies, and your Alaskan Pacific salmon, if you want to get your omega-3s from actual food substances. Omega-3s have also shown very important in reducing inflammation as well. I think I might be running out of time here. I need to hurry. All right. Next up, digestive enzymes. So important with these kids. Poorly digested food is, and I made this in big letters, and I mean it, largely responsible for many childhood disorders. Once again, when they can't break down the food, you have the whole leaky gut thing happening, you have toxicity happening, you have toxins bypassing the blood-brain barrier, you have just so many different problems that are going to happen because of that. Digestive enzymes help the body break down proteins and starches, making them smaller and easier for the body to be absorbed and used properly. So, whereas before these kids aren't able to break these foods down, now with this particular product they can. Okay, and I'll just give a quick little rundown of what's in it. Digozyme is a patented formula of ours. It's a combination of amylases, which are starch hydrolyzing enzymes. You have protease, which is a protein hydrolyzing enzyme. Lipases, which is lipid hydrolyzing enzymes. And then we have a few others as well that are included. You have sucrase. You guys can pretty much just understand with the word what they do. Sucrase is actually hydrolyzes sugars, of course. Then we have maltase, and that hydrolyzes maltose. Now, maltose is a disaccharide that's left over when, stay with me here, when the amylase breaks down the starch. So you also have to break it down again. Now, these kids, in the state that they're in when they first come see me, they can't do that. And that's why a lot of these diets, the GAPS diet, if you ever heard of the GAPS diet, or the specific carbohydrate diet, they tell you do not give these kids disaccharides because they have such an issue breaking them down. Okay, papain it comes from papaya, and it helps to break down animal fats. Bromelain, if I wasn't short on time, I would talk about bromelain for an hour. It's a digestive enzyme found in pineapple stems. Helps to break down casein, which is the dairy protein, and gluten, which is the wheat protein. It has so many wonderful functions in the body, but I'll keep it to that for right now. We make a bromelain product that is wonderful for inflammation, wonderful for just bone breaks, tendon issues, ligament issues, various things. Kiwi protease is another enzyme helps to break down proteins in general. Glutamine is this essential amino acid, and what this does is it serves as an energy source for cells that line the intestine and absorb your nutrients. So if you don't have enough glutamine, your body's not going to be able to absorb things properly. Moving on, and this is the last slide, I believe. We make a DNA Miracles multivitamin, and it comes in isotonic form as well. And I didn't say that the digestive enzymes come in an isotonic form as well, so very absorbable. You don't have to worry about it being, destroyed in the stomach acid and that kind of thing. DNA Miracles multivitamins, we have the first one we have is the Isotonics multivitamin, and that all of those nutrients and minerals is what is in it. I don't have time to go through everything, but the B complex is so important with these kids. Just some quick things that B vitamins do. Protects your immune system, acts as an antioxidant, red blood cell production, promotes good cholesterol, helps break down food to use for energy, responsible for production of certain hormones, can play a role in healthy sleep, lessen inflammation, help control glucose levels, prevent memory loss, and it goes on and on and on and on. So it's very important with these kids, okay? We also make the Multivitamin Plus, which is the Multivitamin Plus is better suited for the kids that are really having some issues. And one of the main differences with that is that there are added B vitamins in that formula. Okay, and then finally we have the gummy vitamins. Once again, for the kids that have some problem swallowing the powders. But yeah, it's it tastes wonderful and very effective. And moving on, this is my contact info for anybody who maybe you want to talk about a child of yours or someone else's child and want to know if I can help a little bit or a lot, or if the office that I work in would be able to help this child. One of the best things about what we do is being able to help these kids get off to a right start. And the ones that didn't get off to a great start, kind of correcting that before they've gone through too much. Okay, so if I can help in any way, if I can answer any questions, please just let me know. Okay, thank you guys very, very much.
Thank you, Dwight. We're going to ask that you get with the person who invited you to attend this tonight if you have any questions. And, of course, you have Dwight's information. Thank you, everyone, for attending.